Victoria, can you hear us now? Ooh. How about now?
Nope.
Still there. It's actually.
How's everyone doing? Can you hear us? Do you hear the echo?
Of course.
Can you hear me okay?
So now it's time. And good morning. You guys hear echo?
It's the headphones.
How about now? Now?
Yep.
I think it's coming from over there.
Is that one up? Yep. Put it all the way. There you go. What about now? Yep. Better?
Is that better? I didn't hear it. Okay. Good morning, San Ildefonso Pueblo. This is the Health and Human Services Department and the COVID response team. We are here today on June 23rd, 2022 for our weekly update. Today we have pretty much the entire team, I think with the exception of Raylene, who is out at another event doing a nutrition consult with our contracted nutritionist and dietitian, Sarah Fallion. She's still doing those nutrition consults if you're all interested. So make sure that you contact Raylene and get on the schedule if you're still looking to get a nutrition consult, because they're still happening. We'd like everybody to get have an opportunity to see that person, see the nutritionist, regardless of whether you feel like you need a lot of extra help or not. The whole purpose of it is to get an idea of where you are with your nutrition, what your needs are, what questions you might have, whether it's going back to the gym and finding out how you need to eat, with with you going back to the gym and eating the way that you need to get the proper results from your eating. Or if you're trying to lose weight, control your blood glucose or blood sugar, or reduce your hypertension or high blood pressure, or reduce your triglycerides because your doctor said that you have high cholesterol, high triglycerides. Lots can be accomplished just changing the way you eat. So the nutrition consultations can be valuable for you, even if you see that person one time. So I know that was like early on. We should be talking about that at the end of the presentation. But, while we're talking about Raylene not being here and a reason why, I might as well throw it in there. Okay. And Thelma just got back from a home visit. So there is a possibility she's going to jump on here in a second. But if not, it'll just be us. Myself, Troy, Department of Health and Human Services Director, LaDon Yazzie, our tribal public health educator, Lenora Arrieta, our ICWA family advocate, Rebecca Jolin, tribal public health nurse, Victoria Martinez, our Healthy Kids, Healthy Communities coordinator, Darylyn Martinez, our COVID community health worker, and Claudia Lenti, our CHR generalist. So with that said, we'll get started with the update. If any member of the team has anything to add, just chime in as necessary, and we get the community notified as best as possible. So here we are today. As of June 23rd, we currently have 3 active COVID cases. It's a little bit better than a couple of weeks ago when we had double digits, or close to double digits, for quite a while there. The fact that they are reducing and staying low is actually a testament to the work that the community is doing to either stay socially distanced or practicing other COVID safe protocols, and the fact that we have had a pretty decent high percentage of vaccinated individuals in the community to help manage the spread and severity of the virus. So with that 3 active cases for this week or for today, our total case count comes to 241 active cases since the beginning, since our first case that the tribe experienced back in November of 2020. Total recovered in that number would be 236 people who have recovered from being sick or being infected with the virus. So our current case numbers for the state of New Mexico. Currently, the cases in the state, as of yesterday, there were 926 new cases. There are currently 175 people who were hospitalized with the virus, with 14 of them requiring ventilation or being on ventilators. There were 8 reported deaths from COVID as of yesterday. And the death rate has been fluctuating up and down, as has the number of new cases every single day over the last couple of weeks. There was a time there that we were averaging over 1,000 cases a day, which is still pretty significant considering the state's high vaccination rate and the public health efforts that the public health community has taken in the state of New Mexico, which is a little different from other states. But so the positivity rate, people are sometimes curious about this. And in the state of New Mexico, the positivity rate, based on what was reported, because we all know that there are a number of individuals who are taking home tests who are obviously not reporting their positives. In fact, a lot of the people that we're getting notified of positives are coming from home tests. And so the positivity rate and the total case count is definitely lower than it actually is, because the information that we have is based on what we know, and we only know what people tell us. But with that being said, based on the numbers that have been reported through DOH as of June 13th, which is a week ago, a little bit over a week ago, of all cases that tested and were reported, 17.4% of those cases were positive. So we're looking at close to 1 out of every 4 tests, 1 out of every 5 technically, that are testing, that are being reported, are positive. That may not seem like a lot, but if you look at, statistics, which a lot of people hate when they go to school, that's a pretty significant number when you're talking about community spread of a virus with such vulnerable members of the population. So the public health community likes to look at they prefer the positivity rate to be at least single digits, less than 10%. So we're a little bit high, and as you can see in the background, the red basically represents high community spread in the specific counties, Santa Fe County being where we are, shows that we still have a pretty significant level of community spread in the state really, but specifically Santa Fe County. It's basically something that we need to pay attention to. So variants of concern, there's always questions about that. We talked about this before, and how the spread and the spikes of COVID are really represented by the different types of variants that we are used to or experiencing in the country and in the state. The green representing the Delta variant, and the blue representing the original Omicron variant. And then you go down to the orange on the end where we are now. That is Omicron, but it is the BA2 variant of Omicron, the one that we are dealing with right now. As you can see, the spike and the numbers of cases that are reported are a lot less than they were with the original Omicron spike or with the original Delta spike. So that is always positive and good news. We never want to go back to where we were back in early 2021 and late 2022, or sorry, early 2021 and late 2021. We never want to be back to where we were, or even the beginning of this year, January, February, when the Omicron spike was at its highest. So with that being said, just have an understanding that even though the numbers and the spikes are low, we do have to look at the margin of error. The fact that since the home tests have rolled out, there have been a lot of positive people who have not reported that they were positive, which therefore puts us in a position of not really knowing the true numbers and the true level of the spike of cases of COVID since the home test rollout started. So that number and those little low spikes that we see in the orange section are not necessarily realistic because it does not. I know all of us and probably all of you know someone who is positive for COVID right now, and the only way that they knew is that they took a home test, and they never reported it to anybody. We barely got notified of it, if notified at all, because sometimes we get notified secondhand by someone else that this person is positive. So if we're not even getting it, I can imagine how many people are reporting to their primary care doctors or to Department of Health so that it gets included in the positive numbers for the state. So I know that went way off topic and started talking about something else, but it is very, very much an important point to make that we're looking at the BA2 variant as not being that significant. But do we really know that? We don't know. Because of the lack of reports or underreporting of positive cases. So with that being said, before we go into questions, I'm going to let Rebecca talk to you all about the recent report from the FDA and the CDC in reference to the newly emergency use authorization, I should say, for the young ones that need to get vaccinated or are now eligible to get vaccinated, and then we can go on from there.
Yeah, so basic information on that is the FDA has approved the emergency use authorization for children 5 years and younger in general. It slightly varies between Pfizer and Moderna. So for Pfizer, there is a series of 3 shots, and it is applicable to children from 6 months old to 4 years old. With Moderna, there's going to be 2 shots. It's going to be 6 months to 5 years old. So they'll probably want to make sure that when you get a series of shots, that they do, in this case, stay within the brand. That may change later, depending on information that they gather from any further studies or trials. The doses that they get for those ages are much smaller than the adults. The adults get 30 for Pfizer, so the children will be getting 30 micrograms for adults. The children get 3 micrograms. So there's a significant difference in the amount of vaccine that they get due to their size, weight, age, development, all that. So there are also a few things, other things to mention that are going on in the state as far as masking and watching out for other infectious disease. So I've also been checking out other things that are going around. It's obviously allergy season with the rain that's going on, and now we're into the summer for seasonal allergies with flora. And they've been monitoring the flu cases that are happening in the state. And they've noticed that with flu A, they've seen a slight increase around the state. Normally we run about 3.4% or less. So anytime it goes over that, they start really watching it a little bit more closely. So we're currently at 3.7%. And it's important to remember that flu is also a virus, and it can impact vulnerable populations and is easily spread among people. So masking also helps with that. And I've also noted that recently, as of the past couple of days, UNM has released a statement saying that they are recommending people return to masking. They're not mandating it amongst their campus, but they are saying that it's a good idea to again return to masking in public areas and whatnot. And so that's a good thing to keep an eye on, because obviously they have the hospitals there and they have all the students in one location. So I just wanted to put that out there for folks to keep informed.
Thank you for that. I wanted to add a couple of things. And when Rebecca was talking about the age ranges that each one of the vaccines, the new approval addresses, there's a reason for that difference in age range. If you recall, Moderna's young pediatric doses that they were authorizing prior were started at age 6, whereas Pfizer started at age 5. So when you hear Moderna saying between 6 months and 5 years, and Pfizer saying between 6 months and 4 years, well, that's the difference. Is that there is a difference with between the two, where they previously provided approvals for vaccinations. So of course they can't say 6 to 4 years old if they've already approved, or 6 to 5 if they've already approved it from 5 and up. And Moderna can't say 6 months to 6 years old because they already approved it from 6 and up. So there's a little bit of a difference, and that's the reason why it sounds like, wait, that sounds kind of weird. Well, it sounds weird because the different studies that they've done with regard to the vaccines between the different companies, they did their studies on different age groups, the beginning range of the age group. So if they did their study from 6 and up, then they can only authorize from 6 and up. If they did their studies from 5 and up, they can only authorize from 5 and up. So additionally, there's a pre-printed article that's coming out from Lancet. It's a study of antibodies regarding COVID-19, whether it's from previous infection or from vaccination. And this kind of goes along with what Rebecca was talking about UNM and other entities recommending masking again. And what they're saying is that with the new variant, the virus is actually evading antibodies, neutralizing antibodies for the virus, whether you were previously infected with COVID or whether you were vaccinated. It is finding its way around the neutralizing antibodies that have been produced, and and this has been happening systematically since Delta. The first major significant mutation with Delta, they started noticing that the vaccinations and the previous infection has not been as protective when it comes to the neutralizing antibodies and the new variant. So, and it's gotten worse and worse, it seems like, as the different variants and subvariants come along. So recommending masking again is important, for that reason, specifically for that reason. Whether you're vaccinated, you have previously been infected with COVID, the fact is that there is a possibility that you're still going to get infected and still get sick, even if you're vaccinated with the new variants, because the virus is constantly changing. Not to say that that's going to happen with everybody, but it's almost like if you don't wear your seatbelt in your car and you get into a wreck and you say, "Oh, I wish I would have had my seatbelt on," you really can't look at it as a protective thing if you don't use it. So whether it's a mask or it's social distancing or it's hand hygiene and washing and keeping surfaces clean, if you don't do it because you feel like this pandemic is over and the virus is not that big of a deal anymore, you're going to have an issue if you are that person, or your neutralizing antibodies are the ones they're referring to in the study where it's saying that it's evading those antibodies. So that's just a little bit of information based on a new study. It's actually going to get released in the Lancet Infectious Disease Journal on June 30th. They sometimes release them preprint so that folks like us can review them and kind of give early indication. So just in case you want to look it up, that's where it's going to be. So with that being said, if you don't have any questions, we're going to move forward. But if you do quite have questions, like always, you can contact us on the COVID hotline, 505-252-5986, or you can email us at covid@sanipueblo.org. We're still here for you, whether you're exposed to someone who's infected, or you are infected, or you have questions about COVID. Somebody's always available to have a discussion with you and talk to you about the what ifs. And I wanted to cover one more thing before we move ahead. And this is specifically for tribal employees. So there's a lot of questions recently about what happens when a tribal employee, especially if they are not subject to the executive order because they're not a tribal member. What happens if you're either infected or if you're exposed to someone who is infected and you're awaiting test results? Because as we know, you can't test. You're not supposed to test after exposure until 5 days after you're exposed to someone who has been confirmed as having or who has tested positive for COVID. So for tribal employees, a lot of questions are coming forward saying, do we go to work if we've been exposed? What do we do if we've been exposed? Well, it's basically just like what we tell everyone else. If you are a vaccinated individual, meaning you have met the requirements of the Pueblo's definition of being fully vaccinated or up to date, if you're exposed to someone who tests positive for COVID, you don't have to quarantine unless you are exhibiting symptoms. If you have symptoms and you're vaccinated and you've been exposed to someone with COVID, it's completely different from if you were exposed to someone who tested positive for COVID and you have no symptoms. Because really, the only requirement is that you still go to work and you wear your mask just in case you might have contracted or might be a carrier of the virus. The way the executive order reads is that you have 10 days of isolation or quarantine depending on the circumstances. You can test out after 5 days. That same thing matters and is the same for non-tribal member employees as it is for tribal member employees. So if you come across someone who tests positive for COVID, for example, close contact, a cumulative amount of 15 minutes in a 24-hour period and 6 feet or less, that's considered close contact, and you're vaccinated, there are no concerns about work unless you're symptomatic. You still go to work. In 5 days, or at 5 days or greater, you can come or go somewhere else and take a COVID test. If you are negative after 5 days, you continue going to work, but wear your mask for an additional 5 days. So the 10-day range is still there, but you just don't stay home. You're not required to quarantine. On the other side of that conversation, if you come in contact with someone who tests positive for COVID and you are symptomatic and you test positive for COVID, then you have to isolate for 10 days. Unless after 5 days, you decide that you want to test out. You show up, you take a test, you test negative, you come back to work because you are now negative. But you still, just like the person who was asymptomatic or tested negative that I said before, have to wear your mask for 5 more days, still covering the 10-day period. So there isn't a requirement to stay home from work because you've been exposed to COVID, unless you are either symptomatic or you test positive. So there should not be any confusion around that. It's very specifically stated in the executive order. And if you need something to follow, even if you are a non-tribal member, you can take the executive order and look at it, and it very specifically says what you're supposed to do, whether you're exposed to COVID or you test positive for COVID. Some people have this impression that because the restrictions have been lifted and the Pueblo is open, that the executive order doesn't exist. Well, there was never a notification from the governor's office saying that the executive order has been canceled. It is still active, minus the restrictions. It is still active, minus the exposures. It is still active, minus all those other restrictive things that we were dealing with at the time. And so the things that you have to be concerned about is what to do if you test positive, what to do if you become exposed, and if you have to notify us, and when you have to notify us, and what the definition of being vaccinated and up to date is. So those are really the only things that are in the executive order, and that's what you have to follow, whether you are a tribal enrolled person or you're not a tribal enrolled person that works for the Pueblo, because the policy mimics the executive order. So I bring that up because there have been several individuals recently that have asked, what do I do if I was exposed to someone who tested positive for COVID? Well, it's the same as it's been. It hasn't changed. The executive order doesn't override policy or the memo that was put out by the tribal administrator several months ago about what you're supposed to do. So it's still the same. And I'll stop talking about COVID now unless somebody else has something to say. Thelma?
Sorry, I thought I was closing my screen. Well, I just wanted to notify people that we were supposed to have a men's health scheduled yesterday, which was June 22nd, although that had to be canceled. But it has been rescheduled for next week, Wednesday, June 29th, and it's a men's health. It's for those 12 years and over. So, and the presentation is on mental health, which Mr. Troy Campbell is going to be our presenter that evening, and also dinner will be provided. So please let all your husbands, boyfriends, sons age 12 and over or whatnot to come and join us for this outstanding presentation by Mr. Troy Campbell. I hope to see you all there. Thank you very much.
Thank you, Thelma. Appreciate that. Claudia, you have anything?
No, not right now. I'm sorry. I'm
Okay.
a little busy at my transport.
Okay. Thank you very much. Victoria, do you have anything?
Not really, just here day to day. Still doing assessments if anybody's interested. Getting your membership for either Los Alamos or Espanola Anytime Fitness or Milwaukee Wellness Center. So just call me up so we can schedule, and that's about it. I think.
And those assessments are amazing, by the way. If you haven't had one, come on down. Thanks, Victoria. Lenora, you have anything?
Good morning. No, I really don't have anything other than if anyone needs me, I'm here in this office, and it's I have an open door policy, so that's really about it.
Thank you.
Thank you.
LaDawn, do you have anything?
Yes, I do. Well, I wanted to know, next week we're going into our health observance calendar, and I was curious to know if anybody wanted to help me decide on what the next topic would be. You can answer in the chat. So some of the topics that I'm struggling to figure out, things I could talk about, present on. In our calendar, we have National Park and Recreation Month. So I was thinking of a physical activity kind of project or presentation. The other option is talking about UV safety. And then the last one I think everyone would enjoy, the third topic that I have is massages. Something about everybody deserves a massage kind of day. But those are the topics that I'm working on and need some help deciding which one to focus on. But that's one thing I wanted to talk about. And then next month we're also working with Healthy Kids for the Learning Center, talking about different environmental issues, challenges, and then we're also talking about Indigenous knowledge information. Victoria and I will be just sharing a little bit of information. I was hoping to reach out to the community to see if they had anything that would be helpful in sharing with the children, with the kids. So we'll be working with kindergartners all the way up into, I believe, high school. And I think that's really all I have to talk about right now.
Thanks, LaDawn. Did you want to talk about your presentations from recently and how well they went?
Oh, yeah, sure, why not? Last week we had a few special guests. The first one was Jeffrey Folgate from Santa Fe County, and we talked about fire awareness and fire readiness. And we have this information on Facebook and then also our YouTube page. So it's about an hour and a half of information, topics that are specific to the Pueblo, and just really he provided us with information from carbon monoxide to fire extinguisher details, and how we could go about getting up to code, up to date in our households, and then also talking about how we could mitigate some of the challenges in fire safety, or mitigate those challenges posed to fire safety. And he provided us with pamphlets, information, and that information, the hard copies are available at the tribal administration. I left them there with the secretary, and she'll share them with you, but if you're online, she can also share it via email, but that's available there. The next topic we talked about was in regards to Sembrando Salud's farming or the gardening kits that were provided to the community members. We had a special guest, Artie Ozzie, Master Gardener, who gave us tips about how to, start our own garden, start small, and identify some of the plants that that work well together. Some of the plants that we can possibly grow this season and give us an opportunity to get a little bit of experience planting during this season. We had a good amount of rain the past couple of days, so we're thankful for that. But yeah, you can go back online, YouTube, Facebook, and look at those videos. I think they were pretty informational, and then also it was just in regards to National Safety Month, and then also just the gardening piece that encourages nutrition and wellness from our department. So yeah, it was really good. I enjoyed myself.
Yeah, they were good presentation.
Are you talking, Troy? Because we can't hear you.
Wow, I did not realize that. It's like earlier you didn't realize you weren't muted, and I just realized I was muted. So I just wanted you to be able to talk about the thing that you forgot to say earlier if you were ready to do that.
Okay, and I forgot to mention this morning too that we are still doing our walks on Tuesdays and Thursdays, but the time has changed because it's getting hot out there. So the time now is at 8:15. We all meet at the softball and baseball field. So please come out and join us. Again, it's on Tuesdays and Thursdays at 8:15 a.m. Thank you.
Okay. And before I turn it over to Darylyn to see if she has anything, we were just notified of an additional positive case. So we are now up to 4 positive cases. So just wanted to throw that out there because since we have an opportunity to update it live, why not? 1 new case today, which totals 4 total cases. Darylyn, do you have anything to add?
Good morning, no.
Oops, you just got disconnected. I don't know what happened.
I don't either.
Well, Darylyn just had some technical difficulties, so I don't know what just happened there. But while we figure that out, we're going to give Rebecca an opportunity to provide an update.
Okay, so I was at the Learning Center on Tuesday, and we had a great time in the morning. I brought in some petri dishes, and we got some swabs and swab stuff around the room, and we inoculated the petri dishes with the swabs, and today they're ready to go back to the Learning Center so the kids can all see how much bacteria and germs are around them in their environment. These things are normal. They every day we live with bacteria in the environment. They're at certain levels that are beneficial to us, but also it helps reinforce how important hand hygiene is and how washing our hands helps keep these levels under control. So I get to do that today. It was a lot of fun. The kids are really great and very gracious and patient. So I can't wait to do that. Next week, I will be going on Tuesday again, and we'll be doing another project where we're going to use some germ gel and then I have a black light, and I'll get to show them how easy it is to spread things around. So these are great little activities, again, to reinforce hand hygiene, and they're fun learning experiences. So I'm looking forward to doing that. Other than that, I don't have a whole lot to add currently. Victoria, did you want to add that last thing that you mentioned? No.
Yes, I forgot to mention that just doing your assessments doesn't mean that you have to have a gym membership. It's also to find out your numbers if you just want to do that. So that's it.
Yeah, that's a great service that you offer to everyone, so they can find out where they're at fitness-wise, and so that they don't go and overdo it if they start to work out or exercise again.
Since we're on the topic of fitness assessments, for those of you who have not had your fitness assessment, I think it entails a few different tests. Maybe Victoria could talk about how challenging or how easy it can be. There's quite a few things that she'll go through as far as measurements and just checking your vital information, your vital physical information. I don't know. I'm not on mute. So I guess what I could talk about is the assessment. I took an assessment. Victoria can't hear me.
I wonder why.
But what happens is, during these fitness assessments, Victoria has these calipers that will kind of measure your body fat in different areas of your body.
It should be working. Try again. Can you hear me?
Mm-hmm. What about now? Just a little? She said just a little bit. Just a little. So you just turn up the volume. How about now? Or you want me to speak up?
What number are you?
She should be 2.
Now speak.
Mic check. Nothing? Mic check.
Mm-hmm. It is.
Well, it's 11:53, and you would think that this would not be an issue, considering we've been running this whole time, and now something has happened. I think it's LaDon's computer over there. Can you hear me? Yeah, see, it's your connection over there for some reason.
We'll fix it.
Don't worry about it. You can grab that microphone right there if you'd like to, and try that and do something different.
I don't know. Can you hear me now?
No.
Mic check.
Because I can hear it.
I don't know. That's
Oh
okay.
well.
That's okay.
We'll give LaDon her stage at the next time, and that way we can get an opportunity to hear a lot more about what she does and is doing, because she is the tribal public health educator and she likes to educate people. So we'll give that opportunity. But we were trying to talk a little bit. You were talking about the assessments, right? And talking about how how that goes. So in that process, it's interesting if you guys are not aware of it. There's a lot that goes into it, even though it doesn't seem like it's a lot. But the interpretation of the data that Victoria collects, it goes a long way. Whether it goes from your BMI or body fat measurements, or your current cardiovascular health, or your weight, or your flexibility, basically, trying to get a snapshot of your overall fitness health at this particular moment in life. Now, it's not 100% accurate because we don't have the tools to do everything, but it is enough to give you a little bit of an understanding of where you are. And I know that LaDon was able to participate and get hers done, and so was Raylene. I still have to get mine done. I keep forgetting. When I can find a free 30 minutes to get it done, I will do that. But it is something that you should all consider, just like the nutrition consultations that we talked about earlier. It is very important to understand what your current health is. One of the things that primary care and doctors don't necessarily do a lot of is trying to promote preventative activities to kind of focus on reducing the risk of developing certain diseases like diabetes and high blood pressure and high triglycerides and high cholesterol and obesity. All of those things can be prevented and or treated using either activity or nutrition. And getting a really good understanding of where you are in those areas is an important first step to making sure that those things are known to you and knowing what the next steps are. Victoria's fitness assessments can kind of figure out the physical portion, as well as some discussion on nutrition that might come up in those conversations. And our contract nutritionist and dietitian, Sarah Fallion, as well as conversations with LaDon, who is our public health educator, can give you an idea of what types of foods or nutritional intake are best for your current condition to kind of try to help treat or prevent those conditions that we talked about earlier. So, Rebecca, you want to tell everybody what's going on? You want to tell them?
Okay. So these are going to be my last part of this week. Next week are my last days here. I have accepted a position in orthopedics where I'll be working with surgeons doing joint replacements. And the reason for that is because it's really close to my house. And I know my contract here is going to end in the near future. So I do need to take that opportunity. I've had a really wonderful time working here at the Pueblo. Everyone has been kind and welcoming, and I really appreciate how nice everyone's been and helpful. It's really been a wonderful experience being here. So I thank you all for that. I've learned a lot, and it's meant a lot to me.
So I wanted to add something to this because, people are not really understanding the predicament that Rebecca's in and the commitment that she's had to the Pueblo since she started. Rebecca doesn't live here. She lives nowhere close to here. She lives all the way in Rio Rancho. So the fact that she was committed enough to drive all the way in to the community and provide the work and services and education and everything that she's done for the Pueblo is an absolutely amazing thing that we were blessed and honored to have. The fact that she was willing to do that for this amount of time is honorable. We also have to take into consideration that she's on a contract, and when you deal with contracts, sometimes there are difficulties, especially when there aren't any. I'm going to be completely transparent. Uh, Clear updates on what's supposed to happen. Sometimes people's positions seem like they're in limbo and it's hard to uh, ask people to commit to something, um, considering the totality of the circumstances, and that's all I'll say. But I just wanted to, thank Rebecca personally and professionally for what she's dedicated and provided for the Pueblo of San Ildefonso, to the team that we have here, the department, the COVID response. I mean, I can go down the list of things that we can thank her for, but you know, I didn't want her to just disappear and nobody see her again, and then you guys have no idea what happened to Rebecca. Uh, well, people have to make choices and decisions based on what's best for them, and considering, her circumstance and the cost of gas, driving in from Rio Rancho every day is not necessarily the best set of circumstances. So I wanted to thank her, and I didn't know if anybody else wanted to add to that before we go, because we are at 12 o'clock. But I'll give everybody who would like to say something to Rebecca in public that opportunity.
I guess I could go first. Thanks, Rebecca. We've learned a lot from you. I like overhearing those conversations regarding the body and health and medication and how things take place in our body. I always found it really fascinating to listen to how you explained those details we weren't familiar with. And then also helping me out along the way with events, presentations. It's going to be tough to kind of work alone, but then again, I have everybody else who have everyone that will continue to hold down the fort, I guess. But it sounds like you have a really good opportunity in front of you, so congratulations on that too. Thank you. Yeah.
Thank you so much.
Well, a lot of folks are not really big on, saying things like those things in public. So, and also it's past 12 o'clock. So we'll probably, talk to Rebecca separately about this. It is something that just came up recently. So the notification of this happening is new, basically, to everyone. So we're still trying to figure out what the path forward is at this point. So yeah, thanks, Rebecca. And it is 12:03. It is the end of our presentation and update. I'd like to thank everybody who tuned in live. And I'd like to ask anyone who watches this later on to put your questions and comments in the comments section. We will respond to them later on as they come up. I'd like to thank the team for providing updates to the community, because the purpose of this entire process was to keep the community informed about things that our department is doing for and with the community moving forward. And I thank the team for helping us accomplish that goal. And as always, it's always great to have this platform and have these conversations. And next week on the 30th, we will have another update, just like always, 11 o'clock, Thursdays. And with that being said, thank you all, and we will see you next week.